Are you tired of feeling thirsty all the time? Do you find yourself constantly running to the bathroom? You may be suffering from a condition that is more serious than you think. Diabetes insipidus is a rare but debilitating condition that affects the body's ability to regulate fluid balance. Join us on this journey as we uncover the truth behind this condition, from its causes and symptoms to the latest research and treatment options. Don't let diabetes insipidus control your life. It's time to take control and understand this condition in depth. Before we go ahead, do make sure that you are subscribed to our channel, Diabetes Health, for more weekly videos on diabetes health and diabetes management. What is diabetes insipidus? Diabetes insipidus, DI, is a condition that affects the body's ability to regulate its water balance. It is caused by a deficiency or dysfunction of the hormone vasopressin, also known as antidiuretic hormone ADH, which is produced by the hypothalamus and stored in the pituitary gland. ADH plays a crucial role in regulating the amount of water reabsorbed by the kidneys, and when there is a deficiency of ADH, the kidneys cannot properly retain water, leading to the excessive production of urine, hence the name insipidus, which means tasteless, in Latin referring to the large amount of dilute urine produced. As a result, people with diabetes insipidus experience excessive thirst and need to drink large amounts of water to compensate for the excessive urine output, leading to frequent urination, especially at night, and dark-colored urine. In severe cases, the condition can cause dehydration, electrolyte imbalances, and weight loss. Types of diabetes insipidus. There are two main types of diabetes insipidus: central diabetes insipidus, CDI, and nephrogenic diabetes insipidus, NDI. Central diabetes insipidus is caused by a problem with the pituitary gland or hypothalamus in the brain, which leads to a deficiency of ADH. This type of diabetes insipidus can be caused by genetic mutations, injuries, tumors, or infections that affect the hypothalamus or pituitary gland, or by certain medications that can interfere with ADH production or release. Nephrogenic diabetes insipidus is caused by a problem with the kidneys, which leads to a resistance to ADH. This type of DI can be caused by genetic mutations, chronic kidney disease, electrolyte imbalances, or certain medications that can damage the kidneys. It's important to note that diabetes insipidus can also be temporary and caused by certain medical conditions such as pregnancy, hypercalcemia, and certain medications, in which case is referred to as secondary diabetes insipidus. How to diagnose diabetes insipidus? A proper diagnosis of diabetes insipidus can only be made by a healthcare professional, usually an endocrinologist, after performing a physical examination, a thorough medical history, and a series of tests including blood and urine tests to rule out other conditions and determine the underlying cause of the diabetes insipidus. What are the preventive measures for diabetes insipidus? Preventive measures for diabetes insipidus DI mainly focus on avoiding or managing the underlying causes of the condition when possible. For example, if diabetes insipidus is caused by a medication, the healthcare provider may change the medication or adjust the dosage. If diabetes insipidus is caused by a medical condition, such as kidney disease, the underlying condition should be treated to prevent or manage diabetes insipidus symptoms. As for specific preventive measures, there are none available for diabetes insipidus. However, it is important for people with diabetes insipidus to maintain a healthy lifestyle, including eating a well-balanced diet, staying hydrated, and exercising regularly to prevent complications from dehydration and electrolyte imbalances. What is the treatment for diabetes insipidus? Treatment for diabetes insipidus DI depends on the underlying cause of the condition. For central diabetes insipidus CDI, caused by a deficiency of ADH, treatment typically involves taking a synthetic form of the hormone, such as vasopressin, which can be taken as a nasal spray or an injection. For nephrogenic diabetes insipidus NDI, caused by a resistance to ADH, treatment may include medications such as thiazide diuretics, amiloride, or indomethacin, which can help reduce urine production. In some cases, a low-salt diet may also be recommended to help reduce urine production. In cases where diabetes insipidus is caused by a medical condition, such as kidney disease, treatment should focus on managing the underlying condition to prevent or manage diabetes insipidus symptoms. Conclusion: diabetes insipidus is a condition that can have a significant impact on a person's quality of life, but with proper diagnosis and treatment, people with diabetes insipidus can lead normal, healthy lives. We've learned that the condition is caused by a deficiency or dysfunction of the hormone vasopressin, also known as antidiuretic hormone ADH, and it can be caused by a variety of factors. We've also discussed the symptoms, prevention, and treatment of the condition. If you or a loved one is experiencing the symptoms of diabetes insipidus, it is important to consult a healthcare professional. With their help, you can get the right diagnosis and treatment plan that works best for you. Remember, early diagnosis and treatment can prevent complications and help you manage the condition more effectively. If you enjoyed today's video, feel free to hit the like button and subscribe to our Diabetes Health YouTube channel. Till we meet in our next video very soon, cheers.